All right, folks. Again, sorry for the delay. We've just got a lot of people on, so that's a good thing. In the interim, I think everybody caught up, and we got a ton of folks joining us today, and we really appreciate that participation. This is Brian Dowd. I'm the Deputy Executive Director over Medical Assistance Plans for the Department of Community Health. And most people on the call probably already know me. Luckily, as I said a little bit earlier, you will not have to hear much from me today, which is a good change for all of us, I think. But we're really going to let you hear from Joe and really see the how the system works. So, Joe, if you'll go to the next slide for me, please. We always start every presentation at the Department of Community Health with our mission, which is to provide Georgians with access to affordable quality health care through effective planning, purchasing, and oversight. Thank you. Next slide. So today we're going to go over, just very briefly, I'm going to go over communication resources. Then we're going to let the folks at TELUS give you an overview of the mobile application. And then we'll have a Q&A session at the end for any questions that you might have. Next slide, please. So I want to once again visit our email site. And there it is. It's the first one on, that's our website. It's our first one that's on there. That has all of the information that we keep for EVV is on that Georgia website. That includes pages, as you see here, specific to members, pages specific to service providers, a page that specifically goes through third-party information, attestation, and technical specs for the aggregator, which is right there on the website for you to have. We also have the EVV Medicaid at dch.ga.gov email address, where you can ask any one-on-one question you have, and we will respond. As of this morning at about 9:30, all the questions had been answered. I know we got a couple since then. Hopefully we were able to respond to those. I know I forwarded one and I responded to the other. So there may still be one out there that's outstanding. And I have said this in other meetings. If you want one-on-one time, if you want to speak to me or you want to have any specific conversation about EVV or your concerns, you can feel free to write that that email address, and I will pick it up and respond to you, and we will get something scheduled. We are also putting all of our PowerPoint presentations on the website, including the audio, so you don't have to be in this meeting to get the resources. Or if you're like me and you like to revisit something, you can go back and revisit it at any time. We are continuing to do flyers and announcements. We have done some readiness surveys. There are frequently asked questions on the website and quick reference guides. All those resources are available for you and will remain available throughout the implementation process for you all to access. We want to be fully transparent in this implementation. Okay, that's it for me today. I promise not much from me today, except a question and answers. If I got something to answer, then I'm going to turn it over to Joe Schnurr, who is the Chief Customer Service Officer for TELUS. And he's going to go through an overview of the actual application for EVV. Turning it over to you, Joe.
Okay, thanks, Brian. Can you hear me okay?
I sure can. I can hear you good.
Awesome. And I apologize. It was mostly my fault on the technical issues, so hopefully we won't have any more going forward here. All right, so I wanted to share a few slides with you that we have shared on a previous webinar, but just a level set. And today's focus is going to be on the mobile application and how it works for EVV data collection on the TELUS system. So first about the mobile app itself. So it works on a smart device, whether that's a phone or a tablet. And we did post the technology specifications on the DCH EVV website. So if you're wondering, will my phone work? Do I have the right software version? All of that information and those specifications are posted on the website, and I encourage you to go there to understand those. How do I download a TELUS app? You would download it as you would any other application from either the Google Play or the Apple Store. It is a free app. There is no cost to download the app. A question we also get is, well, how do I log or how do I complete a EVV visit if I'm in an area without cellular Wi-Fi? So the TELUS app works in what we call offline mode that allows you to complete an existing visit while you're offline, meaning no cell or Wi-Fi is available. You can complete a visit as normal. Then when you get back into an area with coverage, the system will automatically pull the data off the phone or off the device and back up into the TELUS system. You do not have to do anything extra. That will happen without you even knowing about it. As soon as your device recognizes that you now have coverage again. So the device will work when there's no cell or Wi-Fi available. Another question we get is the app tracking me? So the app is not tracking anybody. What it does is it uses GPS to identify the location when the user selects the start visit and the complete visit button. And that's very important for you to understand. So, and that is a requirement by the Cures Act that we must use electronic means to identify location at start and end of the visit. So again, in those two instances, we do use GPS. However, GPS is not enabled at any other time. Not during the visit, not before the visit, not after the visit. So I just want to be very clear on those points. So here's quick of the different screens that you will go through to complete a visit, and it flows from left to right. And I like to show this in addition to a demo, just because you can maybe visualize the progression of how a visit is completed when you can kind of see all the screens laid out in front of you. So it starts with the calendar. And the great thing is now, you don't have to carry around a paper calendar or write down the times of your visits. It's all in the system. Then when you start the visit, you just start the visit by pushing on the visit on the screen. It will launch the check-in screen, which gives you two options, start or a cannot start. And we will go through that. Then when you are done, you check off the tasks that you were asked to complete. In this case, in this example here, you can see cooking and cleaning were my two subtasks. Then I hit all services complete, and I capture signatures for both the recipient and the caregiver, and I hit complete visit, and the visit gives, and then you will go back to your calendar, and you will get a signal that you've had a successful visit, and it's been verified. So pretty easy to use. Hopefully, this is easy to understand. And again, as long as I can get my IT to work for me, we'll walk through a real life demo. So I wanted to list out some advantages of using the mobile application because I realize that maybe many of you are today, you might still be using paper to track visits. And moving to mobile really does open up a lot of opportunities in workflow and efficiencies. So let's go through some of these. So first, the mobile app, a visit can be started and ended at any location. So you can start a visit or end a visit in a park. Of course, the recipient's home, but any other home, the doctor's office. And I realize that many of you don't always start and end a visit in the member's home. So the mobile app really gives you maximized flexibility around providing services in the community. As you saw, we can capture signatures for both the recipient, a family member, a guardian, and the caregiver, which verifies, it gives another level of verification that people are agreeing that yes, these services were provided during these times. Schedules can be downloaded, as you saw on your calendar. They are automatically downloaded when an agency or a fiscal agent is creating the visit from a centralized area. So you may have a scheduler that schedules you for a visit even during the day. And the next time you open your app, that visit will then show up on your mobile app. So again, no need for paper. You can schedule a visit right on the mobile app. So a caregiver could schedule it. Now, this is a controlled feature by an agency or a fiscal agent, meaning that if an agency does not want the caregiver to have this capability, they can turn it off. And then schedules could only be created centralized through the TELUS web portal by an administrator or a scheduler. The service and the tasks to be performed in the visit are visible on the application. And again, we saw an example of that where there was cooking and cleaning were my tasks. We also have a way to allow HIPAA secure messaging between the caregiver and the agency or the fiscal agent. So if the agency says, for example, are you able to perform a visit this afternoon? They could send you that message via the app. Or maybe a caregiver notices something in a visit and they want their agency to be aware of that. They can make a note in the app and send that note to an agency. So for example, maybe your client, you learn in a visit that their sibling has COVID and they're not sure if they've been exposed to COVID. They may have been. That might be something you want your agency to know. You could make a note on that and send that note to your agency via the application. Visit timer. So there is a timer on the app that will continue to count down as long as you are in the visit. So this is a nice reminder because visits are not always started at the top or the bottom of an hour. And so you may start a visit at 22 after, and it's a 1 hour visit. And you may lose track of time and say, oh, how long was I here? You can open the app, and you'll see exactly how long you've been in the visit. The visit notes and the ability to alert the administrator, we talked about that. You can look at your visit history. So you can go back and look at the visits that you completed for the week. Documents can be uploaded. So for an example, a DNR. If your client has a DNR and you have that loaded into the TELUS system, that would be available on the mobile app. The recipient's phone number and emergency contact information is also on the app. If you were to ever need the emergency contact information, again, it's right there in your app. And then directions to the visit location via Google Maps. Now you will need to download Google Maps, which most devices already have that loaded, but if you didn't, you would need to download that app. But the app will automatically send the address to Google Maps, launch that application, and will allow you to get step-by-step instructions or directions to that visit location if you had never been there before. So lots of great advantages to using a mobile application versus, doing things manual. All right, so now I'm going to switch over to my phone. Brian, I'm going to ask you to maybe give me a minute or two until I can get up and running.
Yeah, that's great. So a couple of things while Joe is switching over to actually the actual app. We're getting a lot of questions in the Q&A section, and that's really good. If you're getting it, please put those in Q&A and make them so that everybody can see them. If it's something that has PHI or something that you don't want everyone to see, then please utilize the email box and send them to us via the email box, the email mailbox that I talked about at the beginning, and I think I've talked about in all the presentations, and it is on the DCH website for EVV as well, so that we can answer your questions specifically if it needs to be not broadcast everyone, which we really understand and appreciate. We also won't address individual instances. If it's a broad question, of course, or if we can turn it into a broader question for everyone, even though it's coming from your perspective, then we will, of course, try and do that for you. But if it has any PHI or any hint of PHI, we're going to hold on to that so that we don't violate anything with PHI. One other thing, and it looks like Joe's getting ready to actually show you the app, but I do want to say one other thing real quick. If you don't know the website, go on to Google or Bing or whatever search engine you use and put DCH EVV GA or just DCH EVV. It will be one of the first things that pop up for you there, and you can link to everything from that page. Okay, Joe, turn it back over to you now.
Okay, awesome. Thanks, Brian. And you should be seeing my mobile phone, correct?
Yes, sir. That's what we see.
Okay, great. So and I got to really turn off my email notifications. Sorry about that. At the top, you should see my TELUS EVV mobile app, which I've obviously previously downloaded. And you can see there are two apps on the store, and one will be going away in the next probably 3 months. So probably before you all start downloading the app, the other one will be removed. But if you were to go there today, it's actually called TELUS EVV Plus, and you will see the TELUS symbol here, sort of this leaf in a circle. That's the mobile app that we're using today. And if I go ahead and open it up, it takes me to my calendar. And I had previously scheduled a visit with Jill Tyler. You can see that I had visits earlier in the day with Jill as well, and they were completed. I was late for those visits, so it noted that. And then I have one here that was scheduled to start at 1, but as you can see, it is now 1:26. That is not a problem. We realize that, there's multiple things that can happen between when you schedule a visit and when it actually occurs, travel time. Maybe they asked you to come a little bit later, but you didn't have a chance to upload or update the schedule. All sorts of reasons. The mobile app will still let you start a visit even though you are late. Okay. So I'm going to go ahead and click on Jill Tyler on this visit, and it's going to load my visit. It's basically saying that I haven't logged in a while, so I need to log in again. This is obviously good for security reasons. Okay, so now it's giving me an overview of the visit. You can see that it was scheduled from 1 to 2. You can see the service location, that little symbol next to the location I could use that would launch Google Maps to take me to the location if I need it. And then I have two options. I can start the visit or I cannot start. Let's check the cannot start just so you understand what happens. If I click that, it's going to give me some reasons why I could not start. And there might be, many different reasons. Maybe the recipient got hospitalized and I didn't realize it until I showed up. Or maybe it was a scheduling error and I just need to, basically let the application know that this visit was a scheduling error. And there's multiple reasons there. So that's what cannot start is for. Those are for reasons that for some reason you couldn't do that visit. And then we can track those reasons. But I'm going to go ahead and start the visit by clicking that Start Visit button. Now it's telling me that I am not at the scheduled location. So the scheduled location was Atlanta. I'm actually in Florida. So when I press that button, the system did geolocate me and found out I was in Florida, and it said, hey, wait a minute, you're not in Atlanta. And it will not stop me from starting it. There could be reasons, probably not reasons why I'm in Florida, but maybe there's a reason why I'm not exactly at the location. I will need to designate those later, but the app won't stop you. So I hit OK. It's going to load the visit. Okay, so now you can see the timer that I had spoken about, and that timer will continue to run even if you turn the app off and put your phone down. Because at this point, you have started your visit and you can really now attend to your client. And our goal was to create an app that allowed the caregiver within seconds to start a visit and put their phone down. And hopefully you saw that the app started very quickly. I know I'm talking a lot because this is a demo, but really I could have started this visit in under 5 seconds. So it told me my actual start time was 1:29, and it's telling me that I am scheduled to do unskilled respite care in 15-minute increments. Those are the unit measurements. And I have some subtasks: laundry, meal prep and feeding assistance, bathing, and dressing. So that's what I need to accomplish in this 1-hour visit. So again, at this point, now I'm actually doing my work. So there's really nothing else to do until you are done the visit. But let's say that during the visit, I did notice something with Jill, who is my client here. So in the upper right, you see there's a note section. So if I click on that note, it opens up a box. And this is much like texting. For those of you that have texted before, this is just like texting, only within the application. So it is secure from a HIPAA policy perspective, whereas general texting is not HIPAA secure. And you can see that I had previous notes. In fact, I put a note in earlier, Jill's daughter has COVID-19, and I alerted my administrator of that. That's what the little flag is, meaning I alerted my administrator. But maybe I can just say that Jill has a fever. Maybe Jill told me that, that she was running a temperature, and I'm going to alert my administrator. So I want them to know that. And then I just hit the little green up button, and now that is going to send that message to my administrator. So very easy to enter notes. So again, these notes can be used for any purpose. It could be Jill got a new dog, and I want to remember that her new dog is named Brutus, so that I don't forget. I could enter that in here as well. So I'm back to the visit. You can see now I'm in the visit for 3 minutes and 13 seconds. And so for the purposes of the demo, I am going to now end the visit. So I click the end visit button, and it just asks me, are you sure? Maybe I hit the button by mistake and I would hit no. I don't want to end it, but in this case I do. So I'm going to hit yes. And now it brings me to the screen where I can actually check off or unselect which tasks maybe I didn't get the chance to do. So let's say that I didn't do the laundry. Maybe they didn't need the laundry done. So I unchecked the laundry, as you can see there. And now I can hit the complete and checkout button down at the bottom. So now it's bringing me to the final screen, which is the signatures. You can top that it lists the service and the subtasks. You can see that laundry is listed as incomplete because I unchecked it. You can see that it's saying the signer is confirming that the services above were rendered on Tuesday the 8th from 1:29 to 1:33. So it gives the specifics of the visit and is saying, please sign below to show that you are agreeing that these things happened in this visit. And it's asking for both signature of the recipient or the caregiver. So let's say that the recipient is not able to sign. We can click the recipient box. And I have some choices. No signature gathered. So there was nobody to sign. Maybe a family member is available. Maybe the legal guardian is available, or maybe a representative is available. So let's say the legal guardian is available. I hit OK. And now you can see that the screen has changed to legal guardian. And so then I hit the little pencil icon and it opens up a screen and I can sign off that maybe this is, Bob Tyler. And then I am the caregiver. So I'm going to also hit the button and I'm going to add my signature. And so now you can see that I've captured my signature for the visit. So at this point, I am done the visit. I'm going to hit complete the visit. And it's verifying all the information and that it will be sending this information to the TELUS servers so it is available back at the agency or administrator's level. And it did send me back to my calendar and it told me that the visit was complete and successfully verified. So I can hit OK. So that is as simple as it is to use the TELUS mobile app. Again, our goals were to create an app that was easy to use and it does not require a lot of time on the app itself because the purpose of the visit is to provide the services to the client or the member. You can see down the bottom, there's a few buttons. I'm on the home screen. There's also the message screen. So if I click on the message screen, these are all my messages and you can see the one I entered there. And then the other screen in the middle is the list of my recipients. So I will only be able to see the recipients that me as a caregiver are authorized to see. So Jill is my only recipient that I care for. If I click on Jill, it will give me some information, some different addresses, phone numbers, and if the emergency contact information was filled in, it would list that as well. And if there was a document, it would show those. And then I have two options down the bottom. I can either view my scheduled visits, which would also show previous visits, or I can add a new visit, which again, like we mentioned earlier, is up to the agency whether that feature is enabled or not. So if I look at the scheduled visits, it will show me the visits that I did. And if I click on any one of those, I will get the details. This is the visit that we had just completed. And you can see that it did list the services, and I can see that I did not do the laundry today. And if I wanted to add a new visit, I would click add a new visit, and I would go through a very simple workflow of entering in the address, the payer, the start and end time. So let me see if this will cooperate with me. So I selected the address. All right, good, it loaded. Sometimes it doesn't load the payer in the demo. Okay, so then the start date is today. Let's say I'm going to schedule a visit for later on today. So I entered the date. Now I'm going to enter in the start time. And it just has this little wheel that you use to wheel in the time. So let's say I got to come back around 5:30. Okay. And the end time, let's say I'm going until 6:30. Okay. And again, I'm going to use my favorite respite care because I had preloaded in some of the tasks. So let's just say I'm going to go back and do the laundry just for the sake of the demo. So now I would unselect all the other things. Maybe if I was going to go back and help with dinner, I can add that. So it's very easy to just add or take off any tasks that are listed. And by the way, those tasks, they're all set up by your agency per code. And so as we do future demos, we will show how easy it is to add tasks under each code. And at that point, I'm done and I hit submit. And it says that my new visit was added successfully. And if I go back now to my home screen, you can see that I add my visit from 5:30 to 6:30. The only last thing I will share with you is the menu button in the upper left, those 3 lines. I can do some things here. I can change my password. I can manage accounts. So what that means is if I am a caregiver and I'm using the TELUS app across multiple agencies, my app will allow me to have one calendar across all my agencies. Now I also have to have one username and password, but it will allow me to put everything on one app, which I know caregivers have shared they really like that feature. And then you can change or update your profile. You can also switch between Spanish and English in the app. And then you can log out. Log out is important because if you are sharing devices, let's say you have one device in a recipient's home and 3 caregivers are going to use the same device to log visits on the TELUS mobile app. That can be done. However, if I'm a caregiver and I just finished my visit, I need to log out before the next caregiver can log in. Otherwise, the app keeps looking for me. So if I were to log out, it says, are you sure you want to log out? And I hit yes. And now somebody can come in and log in into this app. And they would actually type in their own username, because that's my username, and their own password. Then they could log their own visit using the same device. So hopefully that was a good overview of the mobile app. So Brian, I will turn it back over to you for a minute, and then I will get the slides back up.
Yeah, thanks, Joe. And thanks for that overview. That was great. So I am monitoring the Q&A. We have roughly 500 people on today, and we've gotten a lot of questions. Some of you guys are putting your questions in chat. And if you could put them in Q&A, that would be really helpful. We will try and go through as many of these as possible at the end of the presentation. But I also want to encourage you to go back to the website that I've been talking about now for a good 6 months. because a lot of the questions that are being asked are available already on that website. You can go in and have the information in writing right there on the website and not have to get it out of a presentation. So make sure that you do afford yourself the time to go back and look at all of the information that is available on the website. Thanks.
Great, thanks, Brian. And hopefully you can see the slides again.
Sure can.
Awesome, thank you. So just one last slide on the mobile app, and then I think we'll get into the Q&A, is there are no steps for anybody to take regarding the mobile app at this time. So I would actually ask that you don't download the mobile app, you don't try to register or anything. As we move closer to the go live dates, we will obviously be communicating when you are ready to start with registration, when you can download the app. The only reason I say that is because a couple reasons. One, the app, we continue to make updates, and I wouldn't want you to miss out on updates. And number two, if you were to go in and register and then we register you later, I don't want a duplicate account to come into play. So at this point, there is nothing for you to do. And as we get closer to registration, we will obviously communicate that in multiple different ways. So I just wanted to mention that. All right, so I will turn it over to, I think, either Brian or Lee Clovis.
Hey, Lee Clovis, this is Brian. I can see the questions, so I'm just going to go down them, okay?
Okay, sounds good.
Thank you, though.
Okay.
So the first question that wasn't already answered was, if the caregiver is running late, will the system allow them to clock in, I'm sure, once they make it to the member home, or does the company clock them in with this system? Well, the service starts, you would clock in when the service starts, just like you do now. When you document, you start documenting your service unit when the service starts. So that won't change with EVV in any way. It doesn't have to be in the member's home. We anticipate that most of the service units will begin in the member's home, but we also understand that there are times when the service unit might not start at the member's home. You might be meeting the member at a pharmacy or at their adult day health center or many other places where they could be. That is standard operating for you. So you will just clock in when the service starts. The second question that I see on here is, I use Acumen as my fiscal agent. They use DCI EVV. How does TELUS and DCI work together? Our plan at this point is for all of the fiscal intermediaries, if they have their own EVV system, to have their EVV system aggregate with the TELUS EVV system. That will provide as little interruption to the way that consumer-directed or participant-directed services are being delivered at this time. We do have specific meetings that we're setting up with the fiscal intermediaries. We will have specific breakouts associated with participant direction as well. What if the recipient cannot sign? This is, I think, of the 93 questions we now have, this is probably 20 of them in one way or another. So if the recipient can't sign, or I've gotten this on my email box from several people as well, asking, look, I'm not always home when the aid is coming or when the aid is leaving. There may be two different aids. One aid is coming from 1 to 3, and then another one's coming from 3 to 5, and I'm not home, and my relative or loved one cannot sign. There will be the ability, either administratively or otherwise, for us to work through those individual instances. We won't stop someone from getting services because they don't have the capacity to sign. The next question is, our agency is currently ClearCare to capture EVV. I'm going to stop here and let Joe talk for just a second. If you could give the website that's associated with the TELUS website, and just give a little information about that, that would be helpful.
Okay, so Brian, this is a question regarding I'm using a third-party system. Is that correct?
That is absolutely correct. Yeah.
Okay, great. So yes, if you're using ClearCare or there's a multitude of other third-party EVV vendors out there, TELUS will be integrating with those vendors. Many of them we are already integrated with and working with in several other states. ClearCare is one of them. We are working with ClearCare in 4 different states already, and providers are using their application, their EVV system, and then they will set up a way for you to send your EVV data over to TELUS. So over the next couple months, we will be working with ClearCare and the other vendors to do that. I know we've communicated on other sessions that if you have a vendor and they have not reached out to us already, please ask them to send us an email at integrations@fortelus.com. And I know that is on the FAQs, and there's actually a specific area on the Georgia EVV website regarding the integrations in the process and the specifications.
Thanks, Joe.
Sure.
The next question is, are there handouts for the aides available on the site as well? So there's not specific handouts at this time. There will be on the website as we get closer to the go live date and the soft launch date. I have reviewed, I don't know how many different training presentations for TELUS, which are really, really excellent training presentations on everything from resetting your password to doing scheduling. And there's also a very comprehensive user guide for providers and members that they can go through and see all how the different components work. That will also be made available for anyone who needs them. So those are all things that are to come, but they're not out there yet, and they will all be resources that are available to you. The next question I have is also, how will this service type be recorded, like a visit like CLE, CLB, or CAI? So I do want everyone, again, I want to really encourage folks to go look at the website and the presentations that were on the website previously. This service is specific to personal support services and community living supports, and also personal support services in the Georgia Pediatric Program. It is not for all programs. It is not for all services. It is specific to those services. And those are the ones that we will be capturing out of EVV. All right, Joe, I'm gonna see if this is something you can answer, or if we have to go back to this one. Is all data gathered and stored GDPR or CCPA certified? More and more states are adopting PII standards similar to GCPR and CCPA, Europe and California. I have no idea what that means, so I'm putting myself on mute.
Yeah, I won't be able to do that one justice either, Brian. That sounds like a security type of question. So yeah, we'll have to jot that one down and get back to that person.
Right. Okay. We can do that. So we will, and we're not going to make it through all 104 questions here in the next 8 minutes. So there will be a lot of compilation of these questions that will go into a follow-up Q&A that we will do as we have done with each presentation. And again, I'm going to say this one more time. If you need to get a specific answer to your question, which is us writing you back in writing to certify, and so you have in writing what our response is, you can utilize the EVV website to do that. That's not a problem. We're really happy to do that. The next question is, why have a unique calendar when Google or other calendars are clear leaders in the industry? Why would one think it's an advantage? Well, let me say this about it. EVV is a federal mandate. We're not going to not do it. So we're trying to make as many things as available to make this a positive thing for both providers and members. And we do feel like a calendar and a scheduler is one of those things. The next question is, I typed TELUS into the App Store and 4 appear. Okay, so I know we've talked about this before. We'll give you further instruction on which app to download. But right now, we'd prefer you just hold off on downloading the app until you can really get a sign in and get signed in and everything else. I know we even answered in a previous presentation which one to download. But as Joe said earlier, it's probably a better idea. The pilot starts in April, that we hold off to a future presentation to get that downloaded. Are visits assigned to the calendar? Do we have to use the calendar to log visits, or can they just log in and out when they are in the visit? So for all of the waiver programs, we'll be receiving a prior authorization of how many service units are appropriate. There will be flexibility in the calendar if you need to set a calendar or if you need to vary from the calendar. We understand that, but every plan of care should be associated with a calendar. Every plan of care should meet a person's needs according to a day and a week. That's a standard function of any 1915C home and community-based waiver. It's kind of a core component of the program. So we would expect there at least to be a set calendar that would be associated with the plan of care. Again, not meaning that that can't vary. That if today something happens and you have to go over, or there's a family need and you have to have a whole bunch of units on the front end when you don't need them on the back end, that is availability to do. But yes, we would expect there to be a calendar in use with the service units by the plan of care. The next question is, will this be funded by DCH? I've said this in multiple presentations, so that there is no cost to the individual providers or members for use of the EVV system. Like Joe said, there's no cost for downloading the EVV app. I'm reluctant to say there's no cost to providers at all, because you're taking an hour of your day to day to be on this webinar to learn about EVV. Our hope is that the EVV functionality and that the quality of care associated with it will be worth it once it gets up and running. We answered what if our recipient cannot sign? What if we have more than one individual that we are serving at the same time? If you're having more than one individual, so this is something we're talking through right now in design, where there would be more than one individual that you're serving at the same time. I know there's a few services out there for a limited number of people in some of the waivers where that's a possibility, so we'll make an accommodation for that. If we already have an EVV system, do we have to use TELUS? No. We are an open model here in the state. We're not like many states that force you to use the state solution. As long as your solution that you currently have meets the federal and state requirements, and it can integrate with the TELUS system, then we will allow you to continue to use your system. So DDSN wants us to upload client info like DNR onto this system rather than put in IDD. So that's a very specific now comp question. We'll respond to that at a different time. Will this feature be available for skilled cases as well soon? This is a good question that we get a lot of times around what about if I want to use this service for other things other than just personal support services? What if I want to use it for skilled nursing in addition to our PSS for child cases? So right now, all the state of Georgia has contracted for and all that we will be making available is PSS. That could change at a future time. Many states expand their EVV system once it gets up and running. But at this point, all we have it used for and all we can pay for is for the personal support services or community living support. By using the TELUS EVV system, will Medicaid still require paper timesheets? Another excellent question that I've gotten many times. We are hoping that it eliminates the paper timesheet. We're hoping that we can eliminate documentation as well. So that is our hope. We are hoping that this system will allow us to use the notes and the task services and be able to do that to meet the documentation. We're still going through that with our policy folks and design folks, but that is absolutely positively our goal. The next question is another question about participant directive. It's another Acumen question. I'm going to hold on this question because I think I answered it before, as we're going to try and treat them like any third-party agent who has their own provider system. But there will be additional trainings that are specific to consumer-directed and participant direction. Can supervisory visits be tracked and done with the app also? Right now, we don't have specifically that functionality. I'm going to have to go back and look. I know that's one of the goals we had hoped to do, but I'll answer that one in writing as part of our Q&A as well. Do we have to use this app, or can our software vendor submit? Again, that's another one about an alternate. We are an open model as long as it meets federal and state requirements. Joe, you did say it would run on iOS and Android, right?
That is correct.
Right. I'm going to hold us here just because we're at 2 o'clock already. We really appreciate all 116 questions that have been submitted. We will compile those questions and respond to them in a Q&A on our website. I really appreciate all of the involvement today. This has been by far our highest level of involvement. Again, if you don't want to wait for the compiled Q&A, you can email the website directly, and we will respond individually because I know how important that is. So I want you to know that we will respond to all of your questions on an individual basis from the EVV mailbox. We are very much committed to doing that. I want to thank Joe for his excellent presentation today and for all of the information he gave and the walkthrough. I want you to, once again, check out that website with all the information and continue to submit your questions online. Thank you, everyone, and I hope you have a great day.
Thank you, everyone.
Okay.